Hello, I'm Professor Joel Irish. I teach here at Liverpool John Moores University, and I have been asked to talk a little bit about this skeleton that we have here. This is the remains of about a 19-year-old male that dates to the medieval period, and he would have been from Gloucester, which is south from here. It would have been an urban location at that point. In brief, this man was murdered. There was a little case report written by some of the faculty here and students at LJMU, and he died of sharp force trauma. There's some stab wounds and some other injuries that showed that he was actually murdered. And coming from Gloucester, one would assume that he's probably English, or European at least. And it just so happened that when they had the skeleton laid out here about a year ago or so, I looked at the teeth, and see, I'm a dental anthropologist, so I can tell a lot of things by people's dentition. I can tell what they ate, I can tell how old they are, and in this case I can determine to some extent population affinity or ethnicity. And so just by looking at the teeth, there are certain features on them that I can score, and I'll show you that in a second. But we use a range of different plaques. This is called the ASU-DAS system. It's the Arizona State University Dental Anthropology System. And what it does is it covers about 40-some traits that vary across the dentition. Some are on the front teeth, some are on the back, upper, lower, different features, bumps, grooves, and that sort of thing. And so what I do is I score them, and certain traits are affiliated with certain populations. So I started to notice this fellow does not look like he's European. He looks to me like he's more African, from the continent of Africa, either sub-Saharan African or North African. But the cranial features are classic European, narrow nose, nasal sill, and so forth. But the dentition are very highly heritable. In some cases, some of these traits are 80%. So if you use a combination of traits, you have a pretty good idea of what the ethnic or population background of this individual is. Okay, so the way it works is, as I mentioned, we look at these different parts of the dentition. We have the maxilla, the upper dentition, and I would turn the skull over, but all the teeth are going to fall out, so we'll leave it like that for now. And then we have the lower dentition. So we look at features of the crown, cusp number, location, whether or not they have shoveling, which is on the back of the dentition of the upper anterior teeth. Moving on to the lower dentition, what we have here is, if you were to look at the second molar, here we have the first molars come in at about age 6, the second molars come in at about age 12, and these would be your wisdom teeth. And you can see here that they're not fully erupted, and that's because this individual is still fairly young, about 19 years of age. So there's a groove pattern in between the cusps here, and in this case, it's in the shape of a Y. You have the possibility of a plus, an X, or a Y shape. A Y shape is most common on the second molar in sub-Saharan African populations, and less so in Europeans and Asians because of dental reduction. He also has a full 5 cusps on his second molar, which again is a sub-Saharan African trait. Some of the features that really stand out, however, would be this particular trait. This is called the cusp 7. And the way it works, again, it's on the lower molars, and I don't know how well you can see this, but on the tongue side, which would be right in here, there's an extra little cusp that's on the inner part right here on both sides. That is very, very rare in other world populations, and very high frequency, up to 40% in sub-Saharan populations. And so you just compare it to this, and I have it scored here as a grade 2 and 3. Again, there's no enamel extensions on the lower dentition, and then we also can look at a variety of different root traits. Like, for example, does it have a 2-rooted lower canine? That would be a very European trait. This individual doesn't. So overall, once all of these data are entered, as I mentioned, you then put them into the different programs. This one is just done by hand, very simple. Adding up these different traits, the highest score wins. He comes out to be sub-Saharan African, or in this case, black, as in African American looking. He's not African American, but of the groups, he looks that way the most. And then most convincing of all is that he has about a 73.4% chance of being sub-Saharan African. The rest of these different populations, he looks nothing like that. So once again, based on the teeth, this individual, if I had to make a bet on this, he would come out as sub-Saharan African, although the rest of him looks very much like European. So there's kind of a conundrum, but the suite of them, the combination, makes me think that this individual probably did have some African background. Gloucester was a seaport, so maybe he came in from North Africa or what have you. But of interest, we are now doing ancient DNA analysis on this individual. In fact, we took it from some of the teeth. I don't know the result yet, but it'll be interesting to compare this information to DNA.